This is a 2-year-old black short-haired cat, intact female, presented with the prolapse rectum. There are numerous causes of prolapse rectums, but during the spay procedure, I noticed that the urinary bladder had a lot of adhesions around it, thickened wall, and what appears to be a non-patent urachus. I'm going to stick this sterile needle in here, suck some urine back, didn't get any. Okay, I'm going to remove that pendulous appendage hanging from the ventral anterior aspect of the bladder, which is something that should have regressed before birth. I'll discuss this further in a moment. All right, the non-patent urachus was removed, along with a lot of other thickened, very tough, unhealthy tissue of the bladder wall. 5-aught proline, I chose that because it is the minimal inflammatory. It has a minimal inflammatory effect wherever you use it. This is interrupted suture pattern. The ureters are intact. My suspicion is that a chronic UTI caused a lot of straining, and that led to the rectal prolapse. I will put this cat on an anti-inflammatory and antibiotics, other antibiotics than I was initially giving it. I was not expecting this. Okay. First off, I apologize for the initial video. I was holding a cap to a syringe in my mouth, and it was causing my voice to be altered. The surgery's over. Of course, she was spayed while I was in there. I wanted you to see the rectal prolapse, no doubt coming from straining. I'm quite confident that the urachus on the bladder, which should have detached during the fetal developmental process, once the kitten was born, that urachus should have retracted, and a normal urinary bladder wall should have formed. It was closed in one layer. Normally it is two, but it's such a thickened wall that I chose to use interrupted, and I feel like that is going to be sufficient. There was no way I could do double layer closure on that thickened bladder wall, at least a ½ inch thick. Okay, going to put her on Baytril antibiotics and continue to treat this rectal prolapse with various safe astringents to reduce the swelling. Honey is safe, and we'll go from there.